All right, Mr. Smith, I'll be back to you in a little bit there with your results. Hey there! Didn't see you there. My name is Darren, and the purpose of today's video is to demonstrate the skills and knowledge a practical nurse needs or requires to have in order to survive their first year in long-term care facility.
Mr. Dockendorf, are you all right? Keep laughing, keep laughing.
What happened, son?
My name is Matthew. I'm your nurse today. What's happening to you is called dysphagia. It means difficulty swallowing. It may take more time and effort for you to move food and liquids from your mouth to your stomach. Any trouble eating or drinking lately?
Sometimes when I eat, I always feels like cut in my throat. And drool like dogs, like a hungry dog there sometimes. I cough so hard, I sometimes poop myself. So,
Those are all symptoms of dysphagia. Dysphagia happens with age. It's not a normal aging process, but the wear and tear in your esophagus can cause this. Also, certain other medical circumstances can cause that too, like strokes.
is there anything I can do, whatever? I mean, do I have to stop eating?
No, you don't have to stop eating.
Gotta eat.
You don't have to stop eating. You should elevate the head of the bed more than this when you're eating or drinking any fluids. You should cut up your food into really small pieces, chew them really well, and limit your distractions while eating. And if you continue to have problems while eating, we may have to consult a dietitian to see if your current food plan is the proper one for you.
Hi, Mr. Dockendorf.
Hello.
Dr. Smith had told me you wanted to know a bit more about how your food's digested and what's involved.
Yeah.
Yeah, so it's called the gastrointestinal tract, and it extends from your mouth down to your anus. And the primary reason for the gastrointestinal tract is to break down food and take nutrients out of what you've eaten and use it to provide your body with energy. So we're going to go through all the structures, and I have pictures.
Oh.
So we start here with the mouth, and as you can see, there's teeth in there to chew up your food and help break it down. And as you're chewing it and the saliva mixes with it, it's called a bolus. And so then the tongue helps move the bolus back to the back of your throat, and then the swallowing motion then puts the bolus down into the esophagus, which is a tube-like structure, and it carries your food down to your stomach. And then your stomach kind of acts like a storage system. And in your stomach, there's churning going on, and the formation of what's called chyme occurs. And then the next step after the stomach is your small intestine. And in the small intestine, that's where most of the absorption of nutrients occur. And then we enter into the large intestine. And this is where absorption of water, ions, and vitamin K takes place. And then near the bottom of the large intestine, the rectum is there, and that is where your feces is stored. And then at the very bottom, you can see the anus, and that's where your feces is expelled during defecation.
Hello, back again. Now I'm going to take the time to describe to you the anatomy and physiology of the urinary tract system. The urinary system consists of two kidneys, two ureters, bladder, nerves in the bladder, two sphincters, and urethra. Now the urinary system works to eliminate water and waste from the body called urea. The kidneys filter the blood. From there, the waste passes through to the ureters and into the bladder, where it's stored until it's ready to be voided. The two sphincters act to hold in the urine, until the time comes for it to be eliminated. When the bladder is full, the nerves in the bladder send signals to the brain that tell them it's time to void. These signals come back to the sphincter muscles, which in turn relax and allow the urine to pass through the urethra and out of the body. Now I'm going to take the time to describe to you the characteristics of normal and abnormal urine. First off, generally a normal amount of urine average adult produces a day is between 1,200 and 1,500 milliliters. Below 1,200 usually is a sign of indication of dehydration or possibly kidney failure in more serious situations. Above 1500, certainly a clear indication of overhydration, or possibly someone's using diuretics for whatever ailment, or it could be a sign of diabetes. Next up, color. Usually color of urine is kind of a pale amber in appearance. Abnormal, well, it can vary from dark amber, cloudy, dark orange, dark brown or red. Consistency, usually, in most cases, urine is clear. When it's not clear, like say like a cloudy, kind of milky looking appearance, that's usually a clear indication of infection. Urine odor, depending on the individual, fresh urine has like a mild kind of aromatic odor. I mean, it can vary depending on how a person smells it. In other cases, though, when it's like a fecal smell, that's usually an indication of an infection. A strong ammonia, that's usually like stale urine, like something that you would find in a tennis system. pH usually averages between 4.5 and 8. Above 8 usually is an indication of a possible urinary tract infection. And this concludes the information of the characteristics of normal and abnormal.
So even though it can be an embarrassing topic to talk about, bowel movements are very valuable in our job. It can offer a lot of clues as to what's going on within a patient. And we're looking for 5 main characteristics. 1 is the color, 2 is the consistency, 3 is the amount, 4 is the shape, and then lastly the odor. So when you're assessing someone's bowel movement, we'll kind of go into the normal first.
Yep.
And then if we stray from that, we'll look into that too. So stool should be a brown color. Consistency should be soft but formed. Normal amount kind of depends on the person's diet, and normal for everyone is different, unfortunately. But anyone who strays from their normal should be an indication that something might be happening.
Yep.
So if someone normally goes once a day and they start going 5 times or more a day, we can have a good educated guess that there is something going on, and we should seek some advice from maybe the doctor and see what the next step should be. So for shape, generally it should have the same shape as the actual bowel. So it should be round, oval, or cylindrical. And as you probably know, stool all has a characteristic smell or odor, but anything unusual or like very strong or something you've never smelled before should be addressed. So, and then abnormal is what we really want to kind of pay attention to. So if we notice, or if you notice any dark, black, or tarry stool, that could be the presence of blood. Hard, dry stools result when there's a lack of fiber or a lack of water or exercise, and that's pretty common here. So constipation is something we want to keep on top of. Unformed or loose bowel movements may also occur as a side effect of medication, stress, anxiety, if they ate something that just didn't agree with them, bacteria, viruses, or parasites. And then we do want to pay a bit of attention to the amount of stool. So again, that's kind of like the bowel routine. If the person strays from their normal amount, that's when we kind of want to look further into things. And again, if there's any unusual or very strong odors coming from the stool, it usually indicates either they've changed medications or the food or even presence of an infection. And if there happens to be long, thin, pencil-like stools, that could indicate a narrowing of their rectum or anal opening.
Min,
Hi.
hello. What brings you in today?
I'm concerned about my grandmother. She's been losing a lot of weight lately.
How old's your grandma?
70.
70. Well, weight loss at that age is usually due to decrease in appetite, which can cause complications. The lack of sensitivity in the taste buds. They can't taste your food, or they lack desire to eat. It's kind of hard to meet an ideal weight. For your grandmother, I certainly have some recommendations for her to kind of help prevent anorexia and stuff like that. One thing I would recommend at her age would be calcium and vitamin D supplements. maintain healthy bones, to avoid those fractures and stuff like that are often common with older people, especially with older women at that age. Another one would be a vitamin B12 supplement or foods rich in vitamin B12. That would help give them the energy boost that they need. Try as much nutritionally dense food as you can get. Maybe greens, things like that. And if you can't get that, then I would suggest maybe use some supplements as well to complement that. Let's see here. Another couple of tips: increase fiber intake, decrease your salt. You don't need any of that because that causes lots of problems. Lots of water, maintain hydration. That's a big thing. And some moderate exercise, because more physical activity that will also help her as well.
Right. Increase your appetite.
So hopefully that will be a big help. If you have any questions, you can call me up anytime.
Thank you. Hi, I'm Taylor, and I'm going to be talking about therapeutic diets. So a therapeutic diet is a meal plan made up by a dietitian and physician, and it usually limits the intake of certain nutrients or changes how the diet is cut up or served so that each person can get the nutritional needs that are appropriate for them. And I'm going to start off with a pureed. So one thing to memorize with a pureed diet is that every food should be pureed separately. And it's mainly for if somebody had jaw surgery and their jaw's wired shut, someone with dysphagia, trouble swallowing or trouble chewing. It just allows them to get the nutrition they need without having any choking happening. And the second one, so mechanically altered or soft diet is basically having everything cut up nice and small so that they don't have trouble chewing or choking on it again. And a renal diet is when your patient might have kidney issues and they may have to limit salt, potassium, protein, just to make it easier on the kidneys. The last therapeutic diet I'm going to talk about is tube feedings. So tube feedings are used for anybody who can't take adequate nutrition in by mouth. So it just allows us to make sure they're getting the right nutrients and the right amount of liquids to sustain their healthy body weight. And that's it for therapeutic diets.
Are you constipated? You might need an enema. An enema is the instillation of a solution into the rectum and sigmoid colon. Enemas can be stimulating or irritating. Enemas are used to remove fecal matter, relieve constipation, establish normal bowel function, and to empty the bowels before surgery.